Hello everyone, I'm Dr. Folu. I'm a family physician and a child health specialist. We'll be talking today about prematurity. Prematurity or preterm delivery happens in about 15 million pregnancies every year. In addition to that, about 11% of all pregnancies are preterm. What does prematurity mean? Prematurity actually means the delivery of a baby before 37 completed weeks of life. The average gestational age is anywhere between 38 weeks to 42 weeks. So when a baby is born before 37 completed weeks of life, we call that baby a premature baby. There are several things that are related or associated with having a premature baby. Some of them include infection in the mother, anatomical problems with the uterus, such as development of fibroids. The placenta could also have some problems such as premature secretion or bleeding, which would happen before 37 completed weeks of life and then lead to development of a preterm baby, birth of a preterm baby. There could also be maternal illnesses such as diabetes, hypertension, which increase the risk of having a preterm delivery. The presence of multiple gestations, such as a twin gestation or triplets or higher order, can also increase the risk of preterm deliveries. When we have a preterm baby, there are some things that we think about, some challenges that would come. And this has to do with the immaturity of most of the developing systems of that baby. The most important and the commonest is that of lung immaturity, which leads to breathing difficulties in the preterm baby. Other things that could also arise are problems with sugar control, where the baby has low blood sugar, which we call hypoglycemia. Problems with temperature regulation are also common, such that the baby tends to have very low temperatures, and this is because the area of the body of the brain that is concerned with regulation of temperature is not fully developed. The baby could also be at higher risk of having infection and also of problems with growth, and this is due to challenges with nutrition. There are important things to note to prevent development or birth of a preterm baby, and the most important is to discuss with your practitioner at a pre-conception visit about the risk or your risk of having a preterm delivery, considering all the risk factors that have been mentioned before. And during antenatal care, ensure that antenatal visits are regularly made and all the precautions that are advised taken. When prematurity does occur, the baby needs to be managed by a multidisciplinary team of specialists, especially if the baby is very immature. This would include management of the temperature, usually in an incubator, and giving of a supplemental source of oxygen, which would assist the baby to breathe. And also, even prior to the delivery of the baby, there could also be some attention given to the mother to help the lungs to develop on time. Thank you.